Hi, we're going to be talking about Chapter 7 today, the respiratory system. Let's take a look at the related combining forms for this chapter. So, structured nose, combining form is nasal. Sinuses is sinusal. Pharynx is pharyngo. Larynx is laryngo. Epiglottis is epiglottal. Trachea is tracheo. Bronchi is broncho or bronchial. Alveoli is alveolo. And then lungs, we have three that mean lung, pneumo, pneumino, and pulmono. Let's look at the functions of the respiratory system. So what are the functions? The functions are that it delivers air to the lungs, conveys oxygen from inhaled blood or inhaled air to blood, expels waste products through exhalation, and it produces airflow through the larynx, making speech possible. The structures, you can see here where the nasal pharynx is, the oral pharynx, the laryngopharynx is here. Here's your nasal cavity. Epiglottis, here's this little lip right here. The larynx is this area. With the trachea, the lung, bronchus is here, and the diaphragm. So we have the upper respiratory tract and the lower respiratory tract. The upper respiratory tract, we have the nose, mouth, pharynx, epiglottis, larynx, and trachea. And then the lower, we have the bronchial tree and lungs. These are located within and protected by the thoracic cavity. Excuse me. Here are the structures of the respiratory system. Here you can see in this little area, here's the frontal sinus, the nasal cavity, the nasopharynx. The epiglottis is back here. Vocal cords, the trachea and the tracheal cartilages, green area. The esophagus, the laryngopharynx, the tonsils, the oral pharynx. Here's the palatine tonsil, pharyngeal tonsil, and then the sphenoid sinuses. So nose, they're going to talk about the nose here first. Air enters through the nose. Obviously, it passes through the nasal cavity. We have the nostrils. These are just the external openings of the nose. We have the nasal septum, which is the wall of cartilage dividing the nose into two equal sections. We have the cilia. These are just real thin hair located inside the nostrils. It does filter the incoming air to remove any debris. We have the mucous membranes. These are specialized tissues lining parts of the respiratory, digestive, reproductive, and the urinary system. Mucus then, this helps moisten, warm, and filter air entering the nose. It's just a secretion produced by mucous membranes. The olfactory receptors, nerve endings acting as receptors for the sense of smell. So it's also important also for sense of taste. The tonsils just help protect body from infection, and that's from entering through the nose or mouth. We have the palatine tonsils, those are located at the back of the mouth. And then we have the nasopharyngeal tonsils, those are located behind the nose and roof of the mouth. We have paranasal sinuses. Looking at that term, we can break that down. Para is near, nas is nose, AL is pertaining to. So these are air-filled cavities lined with mucous membrane. They are located in the bones of the skull. And there are three functions. They make the bones of skull lighter, they give resonance to the voice, and they secrete mucus to lubricate nasal cavity. We have four pairs. We have the frontal sinuses. These are obviously located in the front, just below the eyebrows. This is where infection causes pain in this area. So if you have a sinus infection, this is where your pain is going to be coming from, due to the frontal sinuses. With the sphenoid sinuses, these are located in the sphenoid bone behind the eye and under the pituitary gland. They are near the optic nerves. We have the maxillary sinuses. These are located in the maxillary bones under the eyes. Excuse me, I got a frog this morning. Then we have infection. Infection causes pain in posterior teeth. So you have the maxillary sinuses infection, your teeth, you have pain in your teeth. We have the ethmoid sinuses. These are located in the ethmoid bone between the nose and eyes. It is separated from the orbital cavity by a thin layer of bone. With pharynx, also known as throat, it receives air and food. There are three divisions. The first one is nasopharynx. Naso is nose, pharynx is throat. So it transports air only. We have the oropharynx. Looking at this term, we can break it down. Oro is mouth, pharynx is throat. So this is visible when looking into your mouth. Transports air, food, and fluids to the laryngopharynx. We have the laryngopharynx. Laryngo is larynx. Pharynx is throat. This is where the air, food, and fluids continue to opening of the esophagus and trachea. When the air enters trachea, food and fluids enter the esophagus. So it is shared by the respiratory and digestive system, so laryngopharynx. Larynx, also known as a voice box, it's located between the pharynx and trachea. It contains vocal cords that separate to allow passage of air and also close to assist with sound production. It is sort of supported by the 9 cartilage. Largest is the thyroid cartilage, known as the Adam's apple. So 2 mechanisms to prevent entrance of food or water into the trachea. We have a soft palate that moves up and backward to close off the nasopharynx. This prevents food from entering the nose. And then we have the epiglottis, which prevents food from entering the trachea and lungs. Trachea, also known as the windpipe, transports air to and from lungs. This is located in the esophagus. It is held open by flexible C-shaped cartilage rings that allow food to pass down the esophagus. You can see here in this figure here, the trachea, the bronchial tree, and the alveoli. Here's your trachea, bronchioli, alveoli. Here's your cartilage ring, and then the pulmonary bronchus is here. Bronchi, the primary bronchi branch from trachea to convey air into the 2 lungs. So each bronchus divides and subdivides into increasingly smaller bronchioles. Alveoli are also known as air sacs. They're located at the end of each bronchiole. Site of gas exchange. This is where your gas exchange takes place. Lungs, we have the right and left lung. So the right lung has 3 lobes. We have the upper, middle, and lower. And the left lung has only 2 lobes. It has the upper and lower. And the reason is space is restricted due to the location of the heart. So that's why you only have the 2 lobes on the left. And as you can see here, here's a external view of the lungs. Note the 3, you have the upper, bronchioles, middle, and then the lower, where this one just has the upper and the lower. We have the mediastinum. This is the middle section of the chest cavity. Between the lungs, contains connective tissue, contains organs. So the organs are the heart and its veins, arteries, the esophagus, trachea, bronchi, thymus gland, and the lymph nodes. The pleura, this is just the moist membrane covering outer surface of lungs and lining inner surface of the thoracic cavity. We have the peritoneal pleura. This is the outer layer. This lines thoracic cavity, covers diaphragm, and forms sac containing each lung. With a visceral pleura, this is the inner layer. Then we have the pleural cavity, or pleural cavity space, the fluid-filled space between the peritoneal and the visceral pleural membranes. This fluid acts as a lubricant. Diaphragm, just that muscle separating the thoracic cavity from the abdomen. Breathing occurs as diaphragm contracts and relaxes. You can see here the diaphragm. Here's the phrenic nerves, this one and this one here. So the diaphragm is controlled by the phrenic nerves. Respiration. So respiration or breathing is the exchange of oxygen or carbon dioxide that is essential to life. Inhalation and exhalation. We have inhalation is just breathing in, exhalation is just breathing out. Here's a figure here. Movements of the diaphragm and thoracic cavity produce inhalation, and then exhalation is on the right. External respiration is the act of bringing air in and out of the lungs from the outside environment, and in the process exchanging oxygen for carbon dioxide. Internal is just exchange of gas within cells of blood vessels. So your oxygen passes into cells, carbon dioxide passes into bloodstream where it is transported to the lungs and then expelled during exhalation. Now let's take a look at some of the medical specialists related to the respiratory system. So the first one we have is the otolaryngologist. Looking at this term, oto is ear, laryngos, larynx, O-L-O-G-I-S-T is a specialist. So this is a person that specializes in diagnosing, treating diseases, disorders of the head and neck. Then we have the pulmonologist. Pulmo is lung. They're just specialist in diagnosing, treating diseases, disorders of respiratory system. Thoracic surgeon performs surgery on organs inside the thoracic or chest, heart, lungs, and esophagus. The pathology of the respiratory system, the first term that we have here is COPD, chronic obstructive pulmonary disease. Common cause is smoking. Most people with COPD suffer from related conditions, chronic bronchitis, and emphysema also. Chronic bronchitis then is bronchus. Itis is inflammation, so it's just inflammation, the bronchus. And of course here, this is also related to cigarette smoke. We have emphysema. It's a progressive loss of lung function. Common cause smoking. Lungs over-infiltrate, remain partially expanded, resulting in a barrel chest appearance. We have asthma. It's a chronic inflammatory disease of the bronchial tubes. This may be triggered by allergic reaction. Partial obstruction of airway results in wheezing, and it may be induced by exercise. Upper respiratory infection, acute nasopharyngitis, just known as a common cold, usually due to a human rhinovirus. We have allergic rhinitis. R-H-I-N is nose. Itis is inflammation, so it's just inflammation of the nose. We have croup. This is acute respiratory infection in children and infants. It's kind of like a barking cough. So the results from the obstruction of the larynx and swelling around vocal cords. We have diphtheria. This is a bacterial infection of the throat and upper respiratory infection, or respiratory tract, I should say. Immunization is available for this. Toxins may damage heart muscle and peripheral nerves in diphtheria. Epistaxis, just known as nosebleed. Influenza is acute, highly contagious viral infection. We have pertussis, also known as whooping cough, is a contagious bacterial infection. Immunization is also available for this. We have rhinorrhea. Rhino is nose, rhea is abnormal discharge, so it's abnormal discharge from the nose. Sinusitis, sinus is the sinus, and itis is inflammation, so it's inflammation of your sinuses. We have pharyngitis, just a sore throat. Looking at the term, it just means inflammation. Itis is used for inflammation of the pharynx. We have laryngospasma, sudden spasmodic closure of the larynx. Aphonia, this is loss of ability of larynx to produce normal speech sounds. So looking at the term, A is without, phone is sound or voice, IA is abnormal condition. Then we have dysphonia. This is bad, so it's difficulty in speaking. Laryngitis, just inflammation of the larynx, often results in the loss of your voice if you have laryngitis. We have tracheorrhagia. Tracheo is trachea, rhagia is bleeding, so it's bleeding from mucous membranes of the trachea. Bronchiectasis, bronchi is bronchus, ectasis stretching or enlargement, so it's permanent dilation of bronchi. This is due to a chronic infection or inflammation. Bronchorrhea, just an excessive discharge of mucus from bronchi. Breaking the term down, broncho, bronchus, rhea is abnormal flow. Let's take a look at the pleural cavity. So pleurisy, some terms here is just inflammation of the pleura. You can see in this term here, P-L-U-R is pleura, I-S-Y is a noun ending. Pleurodynia, dynia is pain, and then pleural is pleural. It's a sharp pain occurring when inflamed membranes rub together during inhalation, pleurodynia. We have pleural effusion. This is excessive accumulation of fluid. This is in the pleural space. Piothorax. Pio is pus, thorax is chest. So this would be a presence of pus in the chest. Emphysema is collection of pus in the body cavity. Hemothorax, hemo is blood, so it's just a collection of blood in the pleural cavity. Pneumothorax, pneumo is lung, accumulation of air in the pleural cavity. We have acute respiratory distress syndrome. This is a decreased oxygen levels in blood. It's because of a life-threatening inflammation in lungs and fluid in the alveoli. We have atelectasis. It's an incomplete expansion of part or all of a lung. And this is due to obstruction or pneumothorax. So ATEL is incomplete. Ectasis is stretching or enlargement. Pulmonary edema, accumulation of fluid in lung tissues. Then you have pulmonary embolism. This is a blockage of a pulmonary artery. This is by foreign matter or an embolism. We have pneumorrhagia. It's bleeding from the lungs. Pneumo is lungs, rhagia is bleeding. We have tuberculosis. Tuberculosis is just an infection disease caused by Mycobacterium tuberculosis. Usually does attack lungs, but may affect other body organs. Pneumonia named for the affected lung tissue. So there's two types of bacterial pneumonia. You have bronchopneumonia, affects the bronchioles. Then we have lobar pneumonia, affects one or more lobes of the lung. Double pneumonia involves both lungs. We have aspiration pneumonia. This is due to inhaling foreign substances in the lungs. We have bacterial pneumonia, and then we have a community-acquired pneumonia. This results from contagious infection outside hospital or clinic is where you get that. We have hospital-acquired pneumonia, acquired during a hospital stay. Mycoplasma pneumonia, also known as walking pneumonia. We have pneumocystis pneumonia, and then we have viral pneumonia. Viral will be caused by viruses, obviously. Take a look at the interstitial lung diseases. So these are a group of disorders causing inflammation and scarring of the alveoli and their supporting structures. The first one we have is pulmonary fibrosis. You can break it down: fibrosis, fibrous connective tissue. IS is now an ending. So it's a progressive formation of scar tissue in the lung, causing decreased lung capacity and difficulty in breathing. We have pneumoconiosis. Pneumo is lung, coni is dust, and osis, so it's an abnormal condition of dust in the lung. Asbestoso results in inhalation of asbestos particles. Next, we have silicosis. This is the resulting inhalation of silicide dust. Example would be glass. SILIC is glass. OSIS is abnormal condition or disease, but this can be from ceramics, glasswork, or sandblasting. Any type of occupation like that is where you would see this lung disease. Cystic fibrosis, this is a life-threatening genetic disorder. Results in damage to lungs, poor growth, and nutritional deficiencies. The chest, they can do the chest percussion where they remove all excessive mucus from the lungs. And they also have the pancreatic enzymes to aid digestive system. Lung cancer, this is the leading cause of cancer death in the United States. Cancer cells form the lung tissues. This is commonly causes are smoking and inhaling secondhand smoke. You can see here, this is your normal healthy lung of a non-smoker, and here's one of the damaged lungs of a smoker. So quite a difference there in the two. Breathing disorders, eupnea. It's just EU is good, pnea is breathing. So easier, normal breathing. It's just normal breathing. Eupnea. Apnea is without breathing then. A is without, PNEA is breathing. So it's a temporary absence of spontaneous respiration. We have bradypnea, less than 10 breaths per minute. Brady slow, pnea is breathing. We have Jeanne Stokes respirations. This is a regular pattern of alternating rapid or shallow respirations followed by shallow respiration, or apnea, which is absent. We have tachypnea. Tachy's rapid, so it's more than 20 breaths per minute. We have dysapnea, or dyspnea, I should say. Dis is painful, so it's very difficult or labored breathing a person would have with dyspnea. We have hyperpnea. Hyper is excessive, so it's deeper and more rapid than normal breathing. Hyponia, hypo is decreased, shallow or slow, and hyperventilation then would be a rapid rate of deep respirations. This is commonly associated with anxiety. If someone has anxiety, he has that real rapid rate of respirations, hyperventilating. Sleep-related breathing disorders, sleep apnea is the first one that they talk about here. Breathing repeatedly stops and starts during sleep, potentially serious. Snoring, obviously just noisy breathing caused by vibration of soft palate. We have expectoration, active coughing up and spitting out saliva, mucus, or other body fluid. Hemoptysis, just spitting, so it'd be spitting above blood. Hemo is blood. Lack of oxygen, okay, the airway obstruction. So this airway obstruction would be food or foreign object partially or completely blocks airway, prevents air from entering or leaving the lungs. Anoxia then is absence of oxygen from the body. Hypoxia, less severe than anoxia. Hype is deficient, OX is oxygen, I is abnormal condition. So it's a deficient oxygen levels in body, tissues, and organs. Altitude hypoxia, this of course, it just means due to decreased oxygen in the air at higher altitudes. And especially above 8,000 feet is where you would get the hypoxia, altitude hypoxia. Asphyxia is lack of oxygen leading to loss of consciousness. Cyanosis, it's just a bluish discoloration of skin. And cyan is blue, O is abnormal condition, so it's abnormal condition of blue. Hypercapnia, it's a buildup of carbon dioxide in the blood, so cap is carbon dioxide. Hypoxemia, the decreased oxygen levels in the blood. Respiratory failure, medical emergency consists of either hypoxemia or hypercapnia. Smoke inhalation, these are particles from fire coat alveoli, preventing normal exchange of gases if a person would have smoke inhalation. So it's damage to the lungs. Sudden infant death syndrome, also known as crib death, sudden unexplained death of apparently healthy sleeping infant, may occur between 2 and 6 months of age. Respiratory rate, just continuing the number of breaths per minute. Respiratory sounds, these are evaluation of sounds heard upon auscultation of lungs. Bronchoscopy, just a visual examination of the bronchi using the bronchoscope. We'll break that term down. Broncho is bronchus, scopy or scopy is direct visual examination. Chest X-ray assists with diagnosing lung disorders. Laryngoscopy, these are the procedures, still with the procedures here. Laryngoscopy is a visual examination of larynx and vocal cord. Laryngo is laryngoscopy or scopy is a direct visual examination. Peak flow meter, obviously this measures the airflow out of the lungs. We have a polysomnography, measures physiological activity during sleep. So poly is money, or many, money, poly is many. Somno is sleep, graphy is a process of recording. We have pulmonary function tests also that are done. Spirometer, this measures the volume of air, exhaled, inhaled. Spiral is to breathe, meter is to measure. We have pulse oximeter, oxygen, meters to measure, so it measures the oxygen. Sputum, that is just phlegm ejected through the mouth. Phlegm is just thick mucus. This is secreted by tissues, lung, and respiratory passages. Tuberculosis testing, we have the Manto PPD skin test. So injection of small amount of PPD under the top layer of the skin on the forearm. I'm sure everybody's probably had this done. So I just checked for reaction after 48 to 72 hours. Passive reaction from skin or blood test indicates possibility of exposure to TB. Antitussive prevents or relieves coughing. Anti is against, tuss is cough. It is preforms with a bronchodilator. This is just an inhaled medication that relaxes, expands bronchial passages. So this would be, up here would be just like cough medicine. A metered dose inhaler administers medication in aerosol form. We have a nebulizer. This allows for inhalation of medicated mist. This is via face mask or mouthpiece, is where they put the nebulizer on you. Asthma treatment. Controller medicines, can be controlled with medicines, quick relief, and they say avoid substances that trigger the symptoms, obviously, if you have asthma. Nose, throat, and pharynx. We have the endotracheal intubation. Endo is within, trach is trachea, and nails pertaining to. So they establish an airway, open airway, by passage through the mouth into the trachea. We have functional endoscopic sinus surgery. This is treating chronic sinusitis. What they do by enlarging opening between nose and sinus. Laryngectomy, surgical removal of the larynx. Laryngotomy, surgical incision of the larynx, and that's to relieve upper airway obstruction. Septoplasty, septum, plasty is surgical repair, so it's surgical repair of the septum. Tracheostomy, trach is trachea, ostomy is surgical creation of an opening. So it's surgical creation of a stoma into the trachea for insertion of a temporary or permanent tube to facilitate breathing, a tracheostomy. We have tracheotomy. This is an incision of the trachea to gain access to the airway below the blockage. Lungs, pleura, and thorax. We have pneumonectomy. This is a surgical removal of all or part of a lung. Looking at the term, pneumon is lung, ectomy is surgical removal. Lobectomy is surgical removal of a lobe. We have a wedge resection. This is a surgical removal of a wedge-shaped piece of cancerous lung and margin of healthy tissue around the cancer. Thoracentesis, surgical puncture of chest wall for removal of fluid. Thoracotomy, surgical incision of the chest walls for biopsy or for treatment. They also have a video-assisted thoracic surgery. So this is where they use a thoracoscope to view inside the pleural cavity. Respiratory therapy. So they have the diaphragmatic breathing. It's just a relaxation technique for breathing for relief of anxiety. We have the CPAP machine. This is used for treatment in sleep apnea. We have the BiPAP machine, which is similar to the CPAP, but it can be set at higher pressures for inhaling and lower pressures for exhaling. We have the ambu bag. This is an emergency resuscitator to assist ventilation. We have the ventilator. This is a mechanical device for artificial respiration. This does supplement the natural breathing function if you put on a ventilator. Nasal cannula. It's a small tube divided into two nasal prongs. You have the rebreather mask. Your exhaled breath is partially reused, delivering up to 60% oxygen. Then they have the non-breather mask. This is where high levels of oxygen added to the air taken in by the patient. So these are some supplemental oxygen therapies that are used. And then the last one they have is hyperbaric oxygen therapy. So, a special chamber for delivering pure oxygen. And that's it for the chapter. So please do your workbook and complete the exercises for this chapter. Thank you for listening.